welcome to the Assisted Living Training School. And for today we have Miss Christine Ellis with us.
Amazing. I'm so glad to be here with you.
Thank you for joining me.
In your personal private studio.
Yes, thank you.
Amazing.
So, Miss Christine, you are a registered nurse.
Yes, I am. I have a Bachelor in Science in Nursing.
Very nice.
I started with an AA. As you know, I started as a caregiver, then I become an LPN, and while I was in nursing school, then I got my RN and then my Bachelor in Science. And
Worked your way up.
More to come. I'm
Amen.
looking into really becoming an NP.
I love that.
Yes.
That's wonderful. So, in today's topic, we're going to be talking about infection control.
Yes.
So, you're going to have a lot of input with this and some knowledge and experience with
Absolutely.
that. Having all those roles in the past too.
Yes, I have. Infection control is something that's very near to me because I was at one point appointed by the governor of Arizona to be on one of the board representing assisted living when it comes to infection control for the whole state of Arizona.
That's amazing.
Yes.
And especially, you know, with the things happening in more recent times, there was COVID-19.
Oh, yes.
And you know, there's still infections going on in the assisted living community.
Absolutely.
So let's go and talk about what infection is. So it's a microorganism.
Yep, as you stated it very well. That's exactly what it is, whether it's a bacteria, a virus, or whatever it is. It's something that's trying to take over. It's trying to multiply itself. It's more like a host. You want to take over whatever is good in your body versus what it start multiplying, then you find yourself in trouble as far as your body is concerned or anything else in you.
And it affects your health and how you function, right?
Correct, exactly. Because the minute that you started to have some type of infection, our body was really created beautifully, I will say, and marvelously made, that it started telling us that there's something wrong. And all of a sudden, we start either seeing inflammation, or we start seeing fever, we start seeing pain. Those are the three main indicators that our body's not functioning well and there might be some type of infection.
Wow.
Pain, fever, and also like redness, different colors of things like that.
So being really aware of what's happening in your body, but also in your patient's body.
Absolutely.
You know, so that you can hit it or take care of it before it gets too complicated, right?
Yes, absolutely. What we used to do, because at one point we used to own homes also, assisted living homes, both my sister and I've had to implement a procedure where every day we do vital signs. So our vital signs are very important. Whether the patient was well or not, every single morning we did vital signs on them. But we know our vital signs are our blood pressure, temperature, and pulse, and making sure that we check to see those things are okay.
Yes.
But what happened is that can tell you as an indicator if something is going on with your clients. Don't wait until they're falling over, but your vital signs can really tell.
It's a first indicator.
First indicator.
Oh, that's wonderful.
Yes, yes.
How can an infection spread?
Well, they can spread in three different ways. For example, droplets, they can spread on contact, or they can also airborne. Okay. Those are the three different ways. We call it the CDA. You can put it into all ADC, however, ACD, however, but it's droplets.
A good way to remember it.
Exactly, droplets and contact and also airborne.
Wow.
In those ways. Well, you said, well, what does that mean? Droplets mean that it's little particle, like when you talk, it could be like spit that comes out of your mouth and then it lands on something.
Body fluids.
Body fluids, correct. And then contact is when we touch something. If you're touching things and you're not washing your hands, you can actually touch them and touch your eyes. Those are areas where things can enter in your body, in your mouth, and those kinds of areas. And then airborne, of course, who you're breathing in because it's in the air around you. Those are the three main modes that infection travels. So
in the facility, that's something that we have to take care of, right?
In the facility is the number one place where you have to take care of that. So we tell people your facility needs to really be clean. And you need to really have that as one of the number one thing that you want to make sure of, is that you have a safe and clean environment for your patients to thrive and live in and grow and get better when they come. I know many of family members, they look for that when they walk in your home. If it has a beautiful aroma, the place is inviting, and it looks clean, very
Yes.
clean. It's important. It helps because cleanliness is next to godliness.
Yes, that's very
so
true.
when something is really clean, people feel like relaxed into it, and then they know that it's really a place where they would like to be.
And a place where they can breathe
Yes,
properly.
yes.
A lot of the times we feel suffocated.
Yeah.
And if you feel suffocated in a place, that might not be the right place to
Correct.
be, right?
Absolutely. We love to say to homeowners, declutter your home. You know, declutter. Take things out of the way that you don't need. If you're not using it, make sure that there's space and safe area for your clients to walk around. And when they touch something, it's not dirty. And when they so then they don't touch their face. They don't touch other things.
Yes.
So that's the number one thing.
And in facilities, there are infection control policies and procedures,
Correct.
right?
Yes.
A lot of the time, most of the time, caregivers are the ones that are cleaning the
They're the
surfaces and the
Yes.
residents themselves too.
Yeah, absolutely. It's important that caregivers realize that just because you wear gloves, that doesn't mean you are protecting yourself and your clients.
That's
Gloves are meant to use one time. Whatever it is that you do, that was one of my pet peeves. I tell my caregivers, don't open the door with your gloves on. So whatever you were doing and someone ring the bell, you come out with your gloves in. And then you're going to try to shake people's hands. Don't do that.
No.
Just whatever you're doing, as soon as you finish, you wash your hands, you put your gloves on, you do what you need to do. Once you're done, take your gloves off and then wash your hands again.
Yes.
It's important.
It is very important.
Very important.
Task per task, right?
Correct.
You don't
Every single task.
you don't want to handle one resident with one pair of gloves and then handle another resident with the same pair of gloves.
That's correct. That's really, I mean, that's how we stop the spread of infection, is by making sure that each individual is being taken care of within the place and the time that they're being, and then you move on to the next after you get yourself cleaned up to do that.
Wonderful. So we've started talking about hand washing, right?
Yes.
When is an appropriate time to wash hands?
All the time.
There's never a bad time to not wash your hands.
That's correct. Never a bad time. It ingrained in me as a nurse. I walk into somebody's house, as the first thing I want to do is go over to their sink and wash my hands, because I'm coming into your home and I'm touching different things. So that could also be I'm bringing stuff into your home. Same thing into the assisted living world. When you are in a home, that's the client's home. When you come in, family members, we used to ask them, please wash your hand when you come in. And now more than ever, we are asking people to please wash their hands. We have sanitizers, and don't let that become a habit where you are not washing your hands because you're using sanitizers. Because sanitizers
Nothing can replace it.
Yeah, it's something that is just like in between quickly that you can do that will keep you safe. Of course, you need to use it, but water and soap, there's nothing like it.
20 seconds, right?
20 seconds of water and soap. And if we had to demonstrate it real quick, you put the soap in your hand, you put the water, then you wash, you go like this, then
Make
you
sure
go
you get
like that.
everywhere.
Everywhere like this, and then you also go like this with your hand in the front and the back, like this, and then you just kind of do the little song, happy song.
And you can also
then
go,
you
like, this to get
for this,
underneath your nails.
underneath your nails. And then for me, when I was teaching in the early interest in nursing school, I tell my students to also do the back of their fingers like that, do in between your hands.
Gotta
like that.
rub it thoroughly.
Very, very briskly, you do this, and then you rinse. And when you rinse, and you put your hand under the water like this, and then just like that, and then make sure you rinse it, back and forth. Take your time to rinse, because if you took your time to wash, you should take your time to rinse. And then do the wrist. Make sure that your wrists are all rinsed out and things. And sometimes we even, if you have to go any further, if you had touched anything, put your arm under the water like this and make sure that you get it all clean. Then when you finish, don't wipe it on your clothes.
All that hard work.
All that work, and then you wipe it on your clothes. You ever seen that? People feel, well, we do that at home, and our kids do it when they're little, and we think that it's okay. No, it's not okay. Just don't
grab a paper towel.
Yes.
Make sure you dry them pretty pretty well too,
Absolutely.
right?
And don't pull your paper towel before you wash your hands. Some people
Yes.
do that, they pull it, but that means that paper towel is contaminated because your hand touched it before you washed
it.
Yes.
Yes, it's quite an art form.
Yes,
but
it is.
the more you do it, right, the second nature it becomes.
It becomes second nature for you. I mean, you can tell someone who has a habit of washing their hands, if you watch them closely, you will see them go to that step just like that.
Yep.
Not, like you're breathing, you don't thinking about breathing until
Yes.
you really need to breathe.
That's
So
very
these
true.
days we're telling people wash their hands, so that's something we should have known how to do, that second nature,
Yes.
but now you consciously have to think about it while you do it.
That's perfect.
Yeah.
And especially in the facility. What I tell our students, every time you enter into a residence room, make sure you wash your hands.
Yeah.
After you leave, wash your hands.
Absolutely.
In between, medication administrations, between residents, wash your hands.
Always, always, always. You can't lose from that.
No, you can't. You can never wash your hands too much.
Yes, you can't. And that's what it's important to use something that's not really going to hurt your skin. Just make
That's
sure you
right.
have the proper hand washing solution so that your
Yes.
skin is really always nice and soft and
Nothing too harsh.
correct.
Definitely.
Because you don't want to end up with hands that are excoriated, as we put it.
And sometimes the dish soap can be a little too harsh.
Yes.
So proper hand soap is good.
Correct. Yeah, it's important.
Okay, so let's talk about PPE because we
Yeah.
were talking about gloves before.
Mm-hmm.
And we've seen the nurses put on all that PPE. So
Yeah.
they're
So if somebody's watching and they don't know what PPE is, what would you
Yes.
say that PPE is?
personal protective equipment.
That's correct. That's exactly what it is. Personal. And that word is important. When we say personal, we mean personal. It's yours. It's your equipment. It's what you use it when you use it for. So you can't reuse them. Like if you take it off, somebody else can't put it on because
No.
it's personal protective equipment. Some
That's
of them
very
are reusable, some of them are disposable.
Yes.
They come in two forms. Yeah.
And it's to protect your person,
Correct.
right? To
Yeah.
protect you from, other contaminations, infections,
Correct.
diseases, things of that
So
nature.
you have to make sure that it fits well. You have to make sure you're comfortable in it, and you have to make sure also that it covers the areas that it's supposed to cover.
Yes,
when
it's
you
on
put it
properly.
Correct.
Yes.
Yeah.
So we've talked about the gloves.
Yeah.
That's to protect the hands.
Yes, correct.
Okay, and so now we have gowns.
Yes, we have
What is that
gowns.
for?
Gown is to protect us from attaching, let any infections or things like that get on our own clothes or different other part of our bodies that we can. Because when you're sitting down on something, sometimes when you get up, whatever was on the chair is on you now. Or you brush against something, whatever was on that wall is on you. So with the protective equipment, what we're saying is that now it's on that gown, it's not on you. So you have to really know how to don it and how to take it off
That's
also.
right.
You have to be able to do it properly.
Yes, and make sure that it's not contaminating yourself again.
That's absolutely when you're doing it. Yeah.
And what about masks?
Masks is help us. It's a really tricky thing for people these days because we're telling them that they can use cloth masks. We can tell them that, but masks in our field, in an infection control environment for a facility, it's always disposable for us. So we put them on. The minute we finish being in that environment, we take it off and we throw it away.
Yes.
And to reuse it again mean that whatever was on it, it's still on the mask right now. If you're not really using one that is supposedly disposable, where you wash it after each use, then it defeats the purpose. Because not only that you're breathing in it, remember we talk about droplets?
That's
we talk
true.
about all those things. It goes on the mask. You put it in there. Whatever is on your body is going on there now. And then you let it sit down, it's going to germinate.
Yes.
That's what germinate means, that it's becoming a germ and then things are happening. And then if you put that back on again without washing it, you are doubly getting yourself sick through your own ways of doing it. So mask is disposable as much as you can. And it protects you and it protects also your client. That's the way we use it in nursing. When we walk into a patient's room, who majority of the time, if they have an issue where we're trying to protect them, let's say for example they're on chemotherapy or the immune system is low. So we wear that because we wanted to protect that client. And at the same time, we're protecting ourselves if we work in a room where the client have an infection that is contagious for us not to have it.
Yes. Wonderful.
Yeah.
Now, goggles. You don't see these as often in the facility, but that is part of the PPEs?
Correct. And it is important right now for us to look into bringing the goggles into the facilities because of the fact that things now can be coughed off. When that's droplets again. When someone cough on it, and then it can get in your eyes.
That
when
has
you're
happened.
when you're taking care of patient. In the past, if something that had happened, all we do, we go to the water station, right? We wash our eyes from the inside out and making sure that we get it out, and then go and get our first aid and do all the things we're supposed to do. But these days, because of, again, COVID, and we are dealing with an epidemic, and an infection is very hard to control right now because we are trying to build herd immunity. So it's important to put those goggles on because you don't know when the client is going to cough and something's going to pop. And it's not their fault, it's just happened. And then if you're not properly gowned or gloved or goggled, then you will be in the line to receive whatever they have.
Yes. So you want to prepare yourself and have the appropriate equipment to protect yourself and protect your client as well.
It's important. And I know in this time and frame in time, there's a lot of area where you get help getting those PPEs. And I know for one, I'm familiar with one of the cities, which is the city of Chandler. We still have I think it's a grant that they are giving for personal equipment like that, up to $500.
Wow.
So if people will, that with the facilities and different, they apply for it and give the receipts or whatever they buy, they get up to $500.
Oh, that's wonderful. I'm going to put that link in the description box below. So if that's something that you're interested in, or tell your company that you're working for about it, so that you can get the proper equipment that you need.
Absolutely, because it can be expensive.
It can.
It's very expensive because we're talking about things that are disposable.
Yes.
So if you're not going to reuse it continually, then
it can be pricey.
Very pricey. Yeah, very pricey. But I see things are going down a little bit, the prices, but still you have to pay for them.
Definitely.
Yeah.
Of course.
Yeah.
Now, we've talked about those goggles, but there can be also a face shield that you can use instead, right?
Correct. Yeah, the face shield help a lot because I know that I've used it a lot throughout this whole process because I find that it gives me more, because there are people, it's so hard for them to have the goggles on and the mask on. They feel that they are suffocating, they can't breathe. If you have anxiety or you have any issues, things. For me personally, I liked it because it gave me that freedom of being able to see. Sometimes I had it on, I felt it was so much part of me that I'll be drinking. And take my drink
clear.
It's so clear. I ended up with my drink hand in my mouth because of my mask, because I had it on. I become so used to having it on. It was almost like second nature. But it helps. You can do both. You can do it together in an area where you feel that it's not your normal environment. It's always better to be safe than sorry. You put your mask and then you put your shield on. But in an area where you know it's within your own facility, where all the people where you are around, they are really well protected. You know that they've been tested or they're vaccinated and those kinds of things. A shield is at this time.
That's good. And it's also really nice for the client or your patient to be able to see a face.
Correct. That helps.
Sometimes it can be a little scary with all this covering. And they don't have that personability or that empathy.
Correct.
So seeing a smile always is very helpful.
Specifically when you're dealing with cognitive impaired clients like Alzheimer's and dementia, and if in their past they used to be in those kinds of environment where people used to wear masks and to impress on them or do something to them, and then all of a sudden now they are in your presence with that, they don't know. They can't see you smiling. They can't see and I mean, through this whole process, I was so impressed with some of the caregivers who were willing to put themselves, like nurses, doctors, willing to put themselves in harm's way just to let someone see a smile for a minute, so to encourage them to fight for their lives and those kinds of things. So we heard so many good stories like that.
That's wonderful.
Yeah, it's wonderful.
And throughout infection control, there's those PPEs, that disinfection. Follow your facility's policy, because the facility has really taken care and into account of what that facility needs, right? What surfaces are being touched very often, door
Yeah.
handles,
Yeah.
Counter spaces, things of that nature. So
constantly cleaning them. Your policy and procedure guidelines are going to be your best compass to go through, navigate through this. And that's why the Department of Health Services says that we have to make our own rules. We make them and we present them to them, they accept them. Now it's our job to follow those rules. You got to
Yes.
follow it. When they come, and they need to know that all your things are for safety purposes. They are in locked cabinets, but at the same time you are using them to clean, and you know where they are. You know
Yes.
what to use. Things that are going to be not good for your clients, and you don't use them, but things that are going to be protective of them and help them. That's what you use.
that's very
Yes,
true.
very
And
important.
the chemicals that we use to disinfect, you mentioned that they have to be in locked cabinets.
Yes.
So, you as a caregiver or a manager, you know where they're at, but make sure that it's always locked. You don't want them to
Lock
get
and
into-
labeled.
Yes.
Because it's one thing to lock your cabinet, but it's another thing to label. Because a lot of people visually, when they see that label on there, they know that there's something they should not go. If your client have dementia and Alzheimer's, and I know they know how to pick lock, they know how to open doors, they know how to do all kinds of things because they're trying. They're constantly, their mind is going. They want to get their hands into something. Those who are mobily, like the dexterity, they have issues. They want to touch all the time.
Yes.
Find things for them to keep doing that. But if your cabinets are not labeled, they can't see the danger on there. They will want to be fighting with those to open them. So be safe.
It's good to have different forms of communication on that. So appeal to the visual people,
Yes, yeah.
and then those that are actually trying to
Accredited.
try it, make sure
Yeah.
it's locked.
Yeah.
So that's
Whichever
wonderful.
way, I mean, all of those things is going to help, and then keep reminding them, don't touch that, don't go there, and it's danger, and those kinds of things. Verbal, visual, all of those are wonderful.
It's going to help them be protected away from those bacteria, viruses that we talked about.
Yeah, because they keep touching things. They keep touching, and your clients' hands have to be washed. You use your wipes to wipe their hands before they eat, before they go out, before, when they come out of the bathrooms and things like that, because they're touching everything.
Yes.
And please, this is the time where in this season also that you need to keep washing your walkers, wash your wheelchairs. It's very important to get those. We talk about PPEs, right? So these are DMEs, durable medical equipment. So they are important now because those things are a part of the person mobility.
That's very true.
So it's important to wash them, making sure that we disinfect them also. I know some homes, and I'm so proud of them, see them put them outside, hose them down, get them to get clean and things like that. So it's important to do that.
Anything that's attached to the resident or your patient or even to yourself, make sure that's a cleanliness extension.
Absolutely,
of
like
them.
their canes and things like that.
Yes.
Clean them.
Yes.
Yes.
Make it a habit.
Yeah, before we didn't even think about those things. Once in a while, I mean, for us, once a month or twice a month, we will get the wheelchairs because they eat and things fall in there. We'll get them clean. But now this should be a weekly thing that we do.
Yes, just like laundry should be a little bit more
often.
more often.
Yep, same thing.
But it's the same thing. Anything that is attached to the person that is part of their daily routine.
Correct. ADL.
Yes, ADL.
Activity of daily living. So everything that they use for that activity of daily living should be looking at something that where you need to have to make sure that it's clean for them and it's also ready for them to use it and it's working properly.
Yes.
Yes.
We'll leave it on that note.
Yeah.
That was a wonderful. Thank you for being a part of today's video.
I'm loving it. And this is so great. I like to sit down with your mom, but I think I love to sit down with you. We flow. Your mom really get me going too.
Yes.
We do, but it's amazing being with you. Thank you so much for doing this
Yes.
for our community. It is important that we put the right information out.
That's
Because
right.
information means life and death sometimes.
It does.
Misinformation always lead to death.
That's true.
But information can do both, depending on how the person receives it. But we don't want to put misinformation out. We want to put the right information so it leads to life.
That's right. Thank you so much for sharing your experiences
Yes.
with us and all of your knowledge because, as a nurse and as a caregiver in the past and all of those things as owning
I've done
facilities. And you continue to do more.
Oh, we're trying.
So it's wonderful.
Wonderful. Thank you. Stay safe out there.
Thank you.
Happy in what you do and continue doing it. We need you.
Yes. We'll see you in the next video.
Okay.
Bye-bye.
Bye-bye.